Welcome to Reset and Restore. I am Becca and author of AI for the Soul. And today we have Geralyn Retzel. I've met Geralyn through our alumni group through my university, and I was really touched by her story. She just has such an amazing story that I think was worth sharing, so I invited her on the show here. And I'm just going to give a little brief background about Geraldine, and then we'll get started. So, 40 years, 40 years, Geraldine. You don't, you still look young. For 40 years, Geralyn Retzel worked in a hospital and clinical settings, primarily in psychiatry, as well as wound management, pediatrics, and cardiopulmonary, and has had multiple board certifications. She assists people to improve and harmonize their physical and mental health through principles of natural law and self referral, to tap into the body's inner intelligence through the principles of consciousness based Ayurveda. She developed her capacities as a medical intuitive, sound healer, and multicultural intuitive healer when she studied shamanism with Hank Wesselman and apprenticed under Charles Light Walker, both PhDs. Geraldine learned remote viewing early in her life and holds that each of us are naturally wired to be intuitive. We only need to remember who we really are. As a psychiatric registered nurse and coach, she embraces our life stories as a journey of evolution for the soul's expansion. She is passionate about exploring the relationship of our internal and external universe while utilizing multimodalities for healing through transcendental meditation, Ayurveda, energy medicine, sound, breathwork, and intuitive practices. She holds a Master's of Science in Ayurveda and Integrative Medicine from Maharishi International University and a Bachelor's of Science in Nursing from Washington State University. She's a certified Ayurveda practitioner through NAMA, integrative nurse coach, and a holistic nurse through the American Holistic Nurses Certification Corporation. Amazing. A lot of great experiences in the medical field, right? And then the wisdom of Ayurveda and holistic wellness. Um, and so let's just start off, Geraldine. Share with me. Welcome. I'm so happy that you've taken the time to come here and have this conversation. And just share with me a little bit more of, maybe we'll just start off with like your why, overall with all your experiences. Why? What do you feel like your drive and your passion is?
Hmm. Well, my drive. Well, first of all, Becca, I just want to say thank you very much for seeing my article and finding it useful and interesting. I have wanted to share this story with the medical community for a very, very long time, since I've been 17. And the name of your business, Reset and Restore, is perfect for this because it's really all about connecting with our nervous system, which is the interface between our physiology and our consciousness, and therefore we can restore our wholeness. So rest and reset and restore is just such a perfect opening for this whole podcast here. The main thing that I want to share with people is that we are already whole, and what we have all the parts. We might have a lot of different parts, but what we get to do as human beings is integrate, or I should say bring in and create a wholeness with all of those parts. So we are very fragmented, and I would say that this story that I'm going to share with you will show you how fragmented I was neurologically, right? So when I was 17 years old, I had just graduated from 12 years at Catholic school, private school for 12 years, and it was not my thing. I'm not Catholic in my heart and soul and my spirit. I'm not a Catholic person, but there were many things in that group where I did learn. I learned about the mystics, and to me that was like the most fascinating part of Catholicism was what is beyond this physical world. And like all organized religions, they always said, give your power to me. outside of yourself, not trusting yourself at all, but give it
Hmm.
to the elders of the church or the priests or whoever.
Hmm.
And that never resonated with me, ever, ever, ever. And so I felt that I was given a program that I could not carry myself, and that it was really hard for me to maintain myself in that system for 12 years. And I think what happened is the day after I graduated,
Uh-huh.
I went with my girlfriends to a beach, and I think my nervous system said, I'm done. I've had it. I'm not doing this anymore. I can't take this restriction anymore. So I went up to the concession stand, and at that time, it was a brick building, and at that time, the letters were put in with little plastic letters. We didn't have digital boards. They were all these little plastic letters. And I'm standing there in line, and all of a sudden, all of the letters fall off to the right of the concession stand board. And I'm going, now who would do that? Who would take all of the options that we can order from off the board while we're standing here? And I noticed that all the letters were like over to the side somewhere, all mixed up. And then I noticed nobody else was questioning. They were all just still talking to each other. And then I started losing my balance, and I had an awareness that my body was over to the left of me and I am to the right of my body. And I had
Hmm.
no idea what was going on, and I didn't know what to do about that. I had all my senses with me. I could feel the cold. I could People had touched me, like they said, "Oh my gosh, something's wrong, watch out." Because I was putting my hands out because I had no sense of balance anymore. And I couldn't see, but I had all my other senses.
Hmm.
So somebody had come into the concession stand and led me out. I could feel his arm on me, and he took me outside, and I could feel it was warm out there. So I can feel myself standing there, but I couldn't coordinate myself at all. And he was asking me questions, and I could hear the questions and I couldn't answer them. I
Hmm.
couldn't make my mouth give the words. And so he led me to a room and to the side, and I realized this was a cot. It was like the first aid room. And so, and I had this overwhelming sense I had to sleep. I mean, he sat me down and he sat on a chair across the room and asked me questions. And I said, I can't answer a question. I have to go to sleep. I mean, it was like being drugged. It was
Hmm.
overwhelming. So I slept. And when I woke up, I asked him, I said, how long have I been sleeping? He said, 45 minutes or so. I said, okay. And he asked if I was on drugs. I said, no. And he asked me all these questions. No, I didn't have any of that. And no, I'm not on medicine for anything. I don't know what this is. It's never happened. And so he he goes, well, I know you're not on drugs because you can hold a sentence and you can answer questions back and forth. It's like all of a sudden I was all right. So that 45 minutes really became an indicator of how what I was diagnosed with was a seizure disorder, how it became a pattern for that
Hmm.
seizure disorder. And so there was an evolution of that. And he sent me home. I didn't tell my parents right away. I'm 17, and I didn't really know what to say, and didn't understand it. And my parents, eventually, these seizures kept happening, and I decided I needed to get some help. And so I went to a neurologist, and he did the EEG and all that, which did show some abnormalities at the time. And he put me on phenobarbital. And I said, this is a spiritual imbalance. I know it is. It's a spiritual imbalance. I can figure it out. I don't need this medicine. I need to figure out this spiritual imbalance. I mean, if you think about that, I mean, at 17, how would I know it's a spiritual imbalance? I wouldn't just trust the medical community, right? I have a lot of medical people in my family.
Hmm.
But innately I knew that the problem was in here. And I pointed to my head and my heart. I said, the problem is between here and here, and I can figure this out. I know I can figure it out. And he yelled at me and told me I
The
was,
doctor?
yes. Oh, it was awful. It was just awful. He yelled at me and he walked and raised his hands and, who do you think you are? You're just a child. And I said, no. I said, I do know. I just need to figure this out and I need some time. So anyway, I ended up taking the phenobarbital, slept for like 3 weeks solid. It was just such a devastating medicine for me. And I got the blood work every week. You know, you have to get it because it's hard on the body and the liver. So I got the blood work that was required. And during those 3 weeks, I was not impressed with the medication because I still had seizures. It just moved it to a different part of my brain. And
Hmm.
mind you, there was nothing else for me to do except sleep. So, and wake up and then take a rest every once in a while off the bed. I hardly ate or drank anything really. And it just seemed to me that this medicine was not helpful. It didn't fix the problem. So I went, and what started happening, this was strange, is I was sleeping, and if I woke up too fast, I I have a cleft lip, and the left side of my face, left of this cleft lip would swell up, and I
Hmm.
could feel this tingling before it would happen. So I'm sleeping, and I'm in some kind of a deep state, and if I woke up too fast, I could feel my body and the awakening of this neurological system over here where they did the cleft lip repair. And then my whole face would swell up. And so I'm really off balance, right?
Uh-huh.
And I said, no, this is unacceptable. So I went back down because what would happen, I found this place where I could reach that I would talk to my heart. I would drop
Hmm.
myself into my heart, all my thoughts, all my fears, drop them into my heart, and then swim down to this very deep place. And in this very deep place, I was able to truly rest and relax. And now I know it was the unified field, the quantum field. But I didn't know that then. But I did know that that was a place of silence. It was deep silence.
Hmm.
And, you know, in Ayurveda now, we look at infinite silence as the space between the nerves. I mean, that's one of the things that we do in Ayurveda. And
Uh-huh.
I thought, you know, now when I think about that, is I was able to calm the neurological system of my body and connect my thoughts and my nervous system to my heart, which now we know is the polyvagal nerve and innervating the rest of the body in the trunk of the body and through. So somehow when I was 17 and 18, around there, I had this inner knowing, and it's always with us. It's always with all of us all the time, that innate inner knowing. And I always wanted to help my patients as a psychiatric RN, but also when I worked in medical aspects of medicine as well, is that you are your own healer.
Hmm.
You're innately your own healer. And
Hmm.
everybody, you know, we are responsible for our own cause and our own effect. And we are our cause and we are our effect,
Hmm.
right? And so when I was able to put myself back down into the unified field and come up slowly and wait until I had a space where I could come up where my face didn't swell and
Hmm.
didn't start zinging, then I thought, yes, I can say yes to this thread and swim back up. And if I felt even a tingling, I'd say, no, 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 we have to go back down and we have to try it again because this isn't working. And so I had to do that quite a bit. So once the medication stabilized on me, I went to nursing school. And one of the times we were in the lab and we were dissecting the gastrocnemius muscle in the frog. And it was formaldehyde, I don't know, something happened and I just lifted out of my body. And I have a sense of an aura that happens before this. And I have now like a 30-minute peak of time between when it starts and when it peaks. and I tried really hard to intervene, and I ran out of the lab and I pulled myself back into my body. And I do it consciously. And I root myself back down into my feet and tie things up down there. I mean, I just have to visually do things, root myself
To
back
ground
into
yourself.
my body. And so I had a woman who had, I went to see where near my school, and she had several near-death experiences, and she was very intuitive. And she said, well, these are happening to you because you haven't decided you want to stay on the planet, and
Mm.
that you really, now a lot of these things I couldn't say in my article. I had to cut my article by 1,500 words, so a lot of it isn't in there. But, but she said, if you have a child, you will stay. And I thought about that. I thought, yeah, I always have had trouble, you know, about this, the people and the earth, everybody just seems so mean.
Mm.
And it's like, I don't want to be in a place where people are so mean. I mean, it's just,
Yeah.
it's not what I like. And so anyway, I did have a child, and it, more than one, and it rooted me. Definitely, I like life and living, and they certainly gave me focus and a purpose. However, I also delved greatly into my own mystery, this spiritual evolution that came as a result of this. So I went to a medical doctor over in Portland, and I told him, I said, I'm on phenobarbital. I told him my story, and I said, I really want off, and I would like, you to help me get off of it because it's toxic and I can't just quit. I read
Yeah.
that up. And so he said, I'll take you off if you learn to meditate. So I did. He took me to some groups, and I learned how to meditate, and meditation became my avenue for managing my seizures. As soon as they started, or I had the aura that would happen, a lot of times the aura that happened, I would see the sound of a train, like the Doppler effect, very loud, and they would be coming off from far away, and it gave me time to realize what was happening. I'd
Mm.
start seeing geometric shapes and figures. And later on, when I studied shamanism with Hank Wesselman in his first book, um, they're called phosphenes, and so it's part of entering the trance state. And I didn't know I was entering a trance state. I really wasn't looking to enter a trance state. I'm not even sure why all of this was happening. I'm not even sure I have an answer even now. But it was important for me to realize that when I saw those geometric shapes and could hear, I think was primordial sound, really.
Mm.
And when you think about in Ayurveda and we learn about the gap, everything happens in the gap. You have the,
Yeah.
right, the dynamism and the silence, and the two of them come together, and that's where creation is. And these particular experiences would pull me out to that primordial space of sound
Mm.
and whatever else is out there. I'm not sure what to do with all of this, even now, except it helps me to, in psychiatry, it helped me to realize that just because people might interpret something and take it personally, like we have something in psychiatry called ideas of reference. And so if you think that a song is speaking directly to you, that's could be a sign of psychosis, right? Or if you think that that sign that you drive down the street is giving you a message, that could be a sign of psychosis. And I always felt that that was such a faulty theory, because
Mm.
how does the universe speak to you then? How is it
Uh-huh.
going to speak to you as a human being? I always accepted, that's one of the things I did take from Catholicism, is we are a soul in a physical body and a spirit. But what I learned is that all of that cause and effect is right in here. So um, when I would hear my patients speak, I would teach them how to trust themselves. I said, if
Mm.
that's what that means to you, and that means something to you, and it guides you to do something good for yourself, then accept it as valuable, right? And that's really important. And that's what I really want to share with people as these spiritual emergencies, I guess I would call them, that happen to us, physiological things that happen. Our physiology responds to our consciousness. And
Mm.
there was a great deal of fragmentation in my life when I was 17. I was coming out of so many years of a controlled environment, and I needed it, I guess, because that's where I was placed. But I think I really needed to know that that other expansive universe exists and that there's a way for us to interface. And I was able to learn how to create a coherence between my brain and my heart because
Mm.
consciousness, is seated here in the heart. You
Yeah.
know, it's our vessel. Our hearts are so beautiful. So, these were opportunities. And I just want to say one thing that Albert Einstein said. I always looked for people to support what I thought. And if I could find one, I'd say, yes, see, I'm not too far off. The most beautiful experience we can have is the mysterious. It is the fundamental emotion that stands at the cradle of true art and true science.
Mm.
And, I'm a scientist, but
Yeah.
I feel like there's mystery that cannot be answered. And we're not supposed to have all the answers, but we can learn to trust our way and find our way by
Mm.
listening to that universe within us. And I think that's the most important thing I learned out of this.
Yeah, I deeply resonate with that, and just the whole idea too of how overall I think with the structures within our society or within the structures of religion or certain things that we're kind of like programmed into, we may sometimes along the way lose this connection between our head and our heart. you know and I've had some similar experiences too of not of fainting. Like I fainted before, and I've noticed they were causes of things that were happening in the environment or high stress or things like that. So I think a lot of the root causes to our health issues are our disconnection to of our mind and our heart, and understanding things outside of of the physical realm, or things unseen but yet seen. So maybe you can expand more on, just where is this gap, because you've been on the medical side, and then I mean, it's that gap between science and spirit, right?
Hmm.
Because I really feel like it is one, but there's so much like misinformation or misunderstanding. And just so from your experiences, maybe you can share too, even where is the research that supports some of these things, and how do we integrate the use of medicine or things to support us with mental health?
I think the medical community itself has a long way to go because I think people are afraid to embrace our spirituality as part of our health and wellness. We are getting closer by acknowledging our emotional body and our mental body. We are getting closer, I think, because of becoming more accepting of people's mental health. And I think that was a result that really changed during COVID because so
Sure.
many people struggled mentally during
Yeah.
COVID and spoke about it. And excuse me, I know that as a psychiatric nurse, everybody struggles mentally now and then in their life with depression or anxiety, and it's like a more normal thing that happens than an abnormal thing. But
Yes.
nobody wants to talk about it. But that's exactly what we need to do, and that's part of a true friend. That's part of a true companion, is
Mm.
saying, we're all in this together. This is life in a physical body. It is not always happy. I mean, the most important thing in life is for us to be happy, but that doesn't mean we're always in a state of elation. We want
And
to,
how can we experience and know true happiness if we haven't experienced the opposite of it, right? Sadness.
exactly,
There's a
exactly,
spectrum of things, and that's the beauty of our humanity is we get to experience the spectrum. And
right.
having that understanding as I think as an observer is very helpful. Like what you have done through the things that have the challenges is that you've went through. It sounds like you've taken that position of being the observer, you know, looking outside, looking from outside to yourself within, and asking questions and being curious and discovering like, well, what's going on here, and really listening to your inner self, because that's not easy, and especially for you at a young age at 17, and you had that will to understand, oh, I'm going to listen to what my body's telling me versus what the doctor might be saying, what you need. And I think as a society, sometimes we put so much emphasis on the medical field, or they must know everything. But I think, and too, like as Ayurveda practitioners as well, we try to look at the whole person and understand that we're just a guide, but everybody knows themselves the best, right? Or we've been clouded to understanding through different things, to different life experiences, or clouded to like listening. So how like meditation, going within, like accessing that unified field of where everything exists of consciousness, for somebody who's doesn't understand that or hasn't experienced that, how can they even start? I mean, start by meditating, but what would be some of the things that you would suggest to help somebody to try to get to that point, or to
Yeah,
explore it?
yes. Um, first of all, First of all, I think it's really important that this is where natural law comes in, and I really loved that term that Maharishi gave us, natural law, because natural law means following nature. So that
Hmm.
could mean one of the first steps I would recommend for people is, what is my own nature?
Hmm.
So in order to find out our own nature, we're going to have to unplug from the electronic nature. Right? I think that's one of the first steps because it's a big distraction. It takes us away from our center and it makes us put that power back in the outside world. That does increase our anxiety if you're spending the time on scrolling and looking at whose life is better. I mean,
Yeah.
comparison. I mean, there's things that we do when we go out onto that social media and or listen to the news that just creates anxiety and fear.
Oh,
So
so
the
true.
first step for us, I do believe, is to detach from the external world in a safe way
Hmm.
so that we can sit with ourselves in silence, maybe for the first time, and discover how uncomfortable we are without that external stimulation. And
Yeah.
that might be the first time that a person ever steps away from the outside world and comes back. Is like, say you take 24 hours, you turn off your phone, and can you do that? That's a real good question. Can you turn off your phone and your computer, and who am I naturally, right?
Yeah.
And that's the first place. And then take a small step and say, am I hungry? I mean, start tapping into the senses of your own body because you want to teach yourself to tap into your own intuition. Our
Hmm.
intuition is part of our natural law. So when am I hungry? What am I hungry for? Maybe we might need to ask, why am I hungry for that? Am I thirsty?
Yeah.
Really focus on what your senses are. What is your body saying? What is your body saying to you? Maybe do some stretches. Yoga is great for that.
Hmm.
If you don't know about yoga, just do any kind of stretches that you can think of because you want to come back to your body
Yeah.
and you want to like breathe down into your heart and just if you can people could put their thoughts directly into their heart. And this is something that I discovered myself. That was where the peace started, was
Hmm.
sitting in my heart because the chaos of my seizures was so scary. It was scary to hear that Doppler sound of that train coming towards me. It
Hmm.
was scary seeing those phosphenes, those different shapes. I mean, the universe communicates in geometrics, but I didn't know that at 17,
Yeah.
and I was I was kind of freaked out. But I always found peace inside my heart. So that's another place, detaching from the outside world and go sitting in your heart and maybe moving, stretching and moving would be great
Yeah.
for people to start.
Yeah. I think that's one of the best advice you can give nowadays because we've become overstimulated, and our nerves, I feel like, are just all haywire. So we have to have like that balance between action and non-action, right? We have to
Right,
allow our nervous system to be able to rest, to
right,
restore. And I would often say like meditation is like daily meditation is like brushing your teeth, right? I mean, you do these things daily, self-care to take care of us. And so
mhm,
going quiet, being in silence is cleaning. It's cleaning our nerves. It's
correct,
washing them,
right,
you know?
right.
And we're running so chronic on go, go, go. And and then yeah, the technology and being connected online is a huge thing.
The silence is so essential. It is that place of silence. That's the gap, right? You have the
Yeah.
dynamism on one side and then the silence on the other. And when we can move ourselves away from that busyness into that silence is where we create the healing. And when I learned transcendental meditation, it changed everything for me. I had
Yeah.
a lot of anger, I think, and it just melted away. And it was amazing. It was amazing that I could feel such peace. And Maharishi does teach that meditation purifies the nervous system, like you were saying.
Hmm.
And it really calmed my nervous system. And so if I start, like, if I get into a state of like nature, super relaxed, then comes the aura and then all this change, my body still wants to take off. I want to be in my body. I don't want to leave it. And I know a lot of people look forward to astral travel. I just want to stay inside this body and I have to work at it, right? I have to work at it. So
So you probably have the skills and the ability to astro travel if you wanted
no,
to.
if it happens all by itself, a lot, yes. And I pay a lot of attention to my dreams, and I recommend that too. You ask,
Yeah.
what can people do? Because by paying attention to your dreams and keeping a journal, maybe just writing a few words, you don't even have to remember the whole dream, just a few key words, you might see a pattern. It's also a way to
Yeah.
get to know who you are. And Carl Jung talked greatly about our dreams and the
Yeah.
different aspects and our shadow aspects. I would say that transcendental meditation helped me to deal with my shadow side too.
Hmm.
And, um,
Yeah.
I think that these seizures all started because there was just so much chaos in what I felt like my spirit wanted and being on the earth and what I knew and what I was being taught and what I felt internally that really existed. I didn't think I was being given the truth and it really made me mad.
Yeah.
But
I
it
think
was
it's
also good boundaries for me.
I think it's key what you were saying is, and it really comes down to being more aware of ourselves, even through the subtle little things as far as eating.
Mm.
And so one thing I have been a nutrition coach and personal trainer and helped a lot of people with weight loss and things like that. But some of the simple things that I help guide people with is pay attention when you're eating. Don't
Right.
have any other distractions. Be
Right.
present with your food. Taste what it tastes like.
Yes.
And so that's one. And then eating until you're like, 85, 90% full. So
Right.
all those things require you to be present
Right.
in the moment, to enjoy what you're eating. Because when you start to enjoy and when you're present, all of these things work for you, right? So before you go to eat, when you give thanks for your food, you're starting to secrete digestive fluids just within your mouth, right? And your body's starting to prepare to receive. So it's just these little things that would benefit us if we just slow down.
Mhm. Being
Right?
present was one of the things we learned quite a bit that, for 10 minutes after you eat, you just sit there
Yeah.
and you just let your food digest. It's, rest and repair. Let your food, your enzymes are busy. Let them come out and play and do their job. They want to do their job, but, we don't think about food combining in the standard American diet. And we don't think about eating in peace.
Yeah.
People eat while they drive. That isn't a really great place to be digesting your food while you're eating, right?
And I'll say I've been guilty of that myself. I've lived that fast, quick lifestyle, and yes, it's not easy with the environment that we're surrounded by,
Yeah.
but it's necessary for us to be the example, to not feel pressured if you're at work, like to say, "Hey, I'm gonna go take a break. I'm gonna go walk. I'm gonna eat some lunch," and then take it away from your desk. But so eating and then of course sleeping and being aware, like I also journal and write, and that's been huge. I write when I wake up in the morning, I write before I go to bed.
Hmm.
I sleep with my books in my bed. But the whole idea of that is just making that practice to be aware, whatever it is. If you're not a writer, maybe you voice record, and start to have some kind of practices where you're going within more and asking questions and being curious and having grace on yourself.
Oh, very much. I think that's so important. The non-judgmental self. And see, the thing is, self-referral, our bodies are giving us feedback all the time. Do we want to listen to it?
Right.
I mean, self-referral is, one of those very basic, important foundations of natural law is
Hmm.
paying attention to the feedback that I'm getting from my internal universe and maybe even from the external universe. You
Right.
walk into a room and it just doesn't feel right, maybe you should walk out, right?
Hmm.
Or, maybe if you're eating something that is too acidic, maybe that was enough. That last bite was enough of that. I mean, the
Yeah.
body is always, always telling us we really want to come back home to our body.
And that's why Ayurveda is just so beautiful because we look at it through the lens of the elements and the qualities of the
Yes,
elements, right? And
yes,
air and how and air is a significant of movement, right? So how are if you're eating and you're distracted and you're talking, right? Then you're taking on more air in between bites and
right,
things, and then it could cause more gas, right?
right, 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 right.
But just all those little things and understanding how how our body interacts with water, with fire, and like you were saying, acid, right? If you have acid reflux, then looking at what am I eating? Am I eating too much spicy things? What
Hmm.
is something that I can overact that with something cooling? It's just
Right.
I feel like this wisdom should be taught when we're in elementary school.
That's right.
To
I,
be
I
understand the
agree.
qualities of nature and how they interact.
Right.
with us, with our physiology, within our environment. And then we can come back to being in tune with nature and being more in harmony.
Right. And I think that the part of being in tune with nature is one avenue for people to get in touch with their spiritual self.
Hmm.
Nature is very calming to the neurological system. If you think about mushrooms and how they have all that mycelia underground and that there is this great communication underground with the earth herself is so alive. And Dr. Nader, with his book, Consciousness is All There Is, everything is consciousness, right? And so that's one of the things I discovered when I was having my seizures and I was at that concession stand is my body is conscious.
Hmm.
But I am conscious, I'm over here, but I'm not in it. And so what good is that, right? I mean, what we really need is to be together. We need to take care of the body, we need to take care of the spirit so that they work together. And
Yes.
I think that's where medicine is missing that component of the spirit. Sometimes they bring in the clergy. Unless the clergy people are really, they meet people where they are, I think. But I think medical doctors also need to go there, and nurses are taught to go there. So I feel very fortunate that in my Bachelor of Science in Nursing, I had a very holistic group of nurse educators. And so we were very oriented to the mental, physical, and emotional health of our patients. Nurses in the Bachelor of Science program were learning how to be coaches on that level to the family members, not just
Hmm.
to the patient, but
Yeah.
how is the dynamics of this family affecting the health of this patient? And so
Yeah.
nurses have always been holistically oriented, but we never really had the time. And I don't even think they have the time now to do that as much. But I think now that we're talking more openly about mental and emotional health affecting the physical body, there is more of a chance that we're going to acknowledge that. And one of the things that happened when I was a very young nurse is I was working on a cardiopulmonary unit and I noticed all the patients were having heart attacks, right? Well, that's why they're on the unit. But they were so depressed,
Hmm.
so depressed. And I went to the charge nurse and I said, hey, I noticed that these patients are really, really depressed and they're having heart attacks, and I think that there's a relationship. And she
Yeah.
said, no, 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 there's no evidence for that. And I thought, yes, there is. I can see it right today. And then eventually people started doing research about that emotional heart, and we have Sadhaka Pitta in our Ayurveda, and we look at
Yeah.
Sadhaka Pitta, and where we really need to address our own heart. It's so important. So that's another thing. If people can come into their heart and meet their spirit, their spiritual aspect in there. Who am I really? Who
Yeah.
am I? Who am I separate from all the people that have taught me? Who am I separate from my mother and father, or the people that adopted me, or the clergy people that raised me, or the teachers, or my siblings? What will I allow and what won't I allow in
Hmm.
my life? What belongs to me and what doesn't belong to me? These are
Yeah.
things that you can do in that 24 hours where you're not detached from the whole social media and the electronic world.
Yeah. Where everybody is telling you how to be, how to act, or
Yes.
what
And
you
if you
can
buy
compare
this
yourself
product, your life will
to.
be better. Spend, spend,
Yeah.
spend.
Yeah.
Yes.
Well, Geraldine, it's been such a pleasure to have this conversation, and I feel like there's a lot of things that we can talk about more.
I think so. Yes.
So maybe we can have another conversation, but it was good to just hear your story, to get a background from your experiences, and that we can bring this out to more of the limelight to be normal, right? That
Right.
it's normal that we experience these things that maybe we don't understand or we haven't been necessarily taught. But maybe if there's some last words that you just, want to kind of summarize some key things before we wrap up here.
Yes, I think there would be. I think one of the key terms that people might be using now are spiritual emergencies. And, I would say that is what our physiology is telling us, and illness. There are a lot of components in that. I mean, there's a genetic component, there's the lifestyle component that brought us to that. The cause and effect could come from different avenues. But underlying all of that is a spiritual emergency. How can I utilize my illness or my imbalance to bring me closer to my higher self? Right? Because Atma, the higher self Atma, that which we hold in Ayurveda, is that. It's self with a capital S, right? And learn to trust. Trust your intuition. We're wired for that from the very beginning. Yeah. All animals are intuitive, and we're a human animal. And I would just hope that people will learn to trust what they feel. I mean, in some ways you can't trust everything you think and feel, but you can question it and say, does that really belong to me?
Yeah.
If that belongs to me and it's useful, great. If that belongs to me and it's causing me pain, maybe I could do something different about that.
Yeah.
But try to be the least judgmental about yourself and forgive yourself and let it go and do better now, right? The next step.
Stay curious.
Yes, stay curious. Yeah, that's a good one. Stay curious. And that there's no absolutes. That's an important thing to remember. That unified field, everything exists in there. So it's a good place to hang out and decide what you want to say yes to. Yeah.
Very good. Thank you so much, Geralyn.
You're welcome. Thank you as well, Becca. I appreciate that you honored me to invite me to share this story. And I hope it's helpful.
Yes, it has been. Thank you.
You're welcome. Bye-bye.
It is always strongly recommended that you consult with a personal healthcare provider prior to applying any of the education provided herein. The educational and informational content provided by Reset and Restore is in no way, shape, or form to take the place of personalized care provided by a personal healthcare provider. Please use the information we provide in conjunction with such professional advice. The content we provide is purely educational in nature about Ayurveda and various wellness topics, and is not meant to diagnose, treat, or prevent any disease. We make no claims or warranties to cure, treat, or prevent any disease or condition.